So let's open the app üDerm, specifically the clinic type of this app, and uh, some basics about it is what it does is allows the patient or the MA assisting the patient or nurse assisting the patient to complete very simple visual algorithm questions that eventually generate a nice and neat paragraph form history of present illness with associated pictures of every lesion that they are presenting with. So this was designed by my younger brother and myself. I'm Daniel Heckman. My brother is a coding genius who really made this come to life. And it's named U with an umlaut because it sort of represents a smiley face. So it's a very positive app, and it's about you. It's about the patient versus iPhone, iPad, which are very more self-centered or self-focused. This is about more altruistic, the you approach. So we check in here, and you can see the keyboard pops up right away, and very easy to complete questions: name, age, gender. And the trash symbol in the top right corner can be tapped anytime to discard the lesion and start over. So then just some basic questions are asked: if they visited before and about how long ago, so maybe 6 months, and what they thought that they were treated for. So we'll just say psoriasis. And then some basic history questions: if they've ever had a skin cancer, if their family members have ever had a skin cancer, or if they have any allergies. So if they have, those follow-up questions will be asked once the doctor enters the room. Then we jump into their symptoms. So first of all, do they have any associated symptoms, any systemic like fever, lymph nodes, or anything else? If they do, they can go ahead and type this, like maybe a sore throat or something like that. So this allows them to give us the information of anything associated with their skin lesions. If they tap nothing, everything goes away. So you see how easy that is. So we'll just say that they have maybe a fever and swollen lymph nodes. And then we ask a very general question, because patients, we often find, are very concerned with one thing that might not necessarily be what the doctor is concerned with. So what are you, as the patient, most concerned with? The pain, the appearance, the cancer risk, or something else? And so we'll just say that they're concerned with the appearance the most. And then we go ahead and jump into the lesions. So you see this little flashing positive plus sign. First deals with where is the lesion, and the picture, the camera, allows them to take a picture of where their lesion is. And so we have that capability. We also have them, once they take the picture, to identify using these visual tappable questions of the location of their lesion. So maybe it's on their right temple and also spread to their right cheek and maybe their chin, and also maybe it's on their right hand. Again, it zooms in on hand, feet, and face for a more accurate location, and maybe it's on their right knee as well, and possibly the backside of their left leg. So we have all that, and then it jumps into, here's the kind of cool and fun part: what color is your lesion? Red, skin colored, or just red? How about? And what is the morphology of your lesion? Is it raised? Is it fluid filled, inflamed? As you can see, it's very visual and assists the patient with completing these steps. Is it larger than a centimeter? And if they don't know what a centimeter is, it's roughly the size of the width of their pinky, and so we'll say it is not. And in their opinion, what is it? Is the distribution grouped, scattered, linearly distributed? So they can say it's possibly scattered. Does it have any associated itching or bleeding or any of these other secondary factors? Let's say it's scaling and thickening and itching. And then when did it start? So let's say it just cropped up about 3 months ago. Well, has it been worsening or improving in their opinion? Let's say it's been worsening. It's been getting more severe, more debilitating in their opinion. Has anything improved it? And they can tap other if something has that's not listed here, like moisturizers, antibiotics, steroids. Let's say they've tried some moisturizers. It's helped a little bit. Has anything worsened their lesion? And here's where they can type maybe like the sun, potentially. So now that they're done with that lesion, they can add as many as they'd like with as many pictures as they'd like for each lesion that they add, or they can be done. They click the done part, it goes to the survey that's just quickly asking them how they enjoyed their üDerm experience. Of course, they're going to pick 10 because it was the greatest thing that they've ever done in their lives. And then they hand the iPad to an employee and submit. So what happens is a complete report is generated then in paragraph form of everything, all the questions that they were asked. So it's a nice and neat form with attachments of the pictures. I was not able to attach the pictures this time because as I record my screen, it causes the app to freeze because I think it's too much to process while recording the screen. But I will show you an example of a report with attached image. So that's the app, and obviously there are a lot of advantages to the physician. They don't need to have a completely new EMR to use this app. They can simply copy whatever HPI and images are generated and insert them into their existing EMRs. So that's a huge advantage. In addition to the obvious advantage of saving time and having a more directed and focused physical exam. So instead of note-taking and being a secretary, they can focus on dermatologic medicine and diagnosing and providing treatment and educating the patient. So that's a huge advantage in my opinion that will shave at least 10, maybe 15 minutes off of every visit. And then there are advantages to the patients as well. So they have a way more active role in their treatment. Instead of just waiting for the doctor to see them, they can actually help and assist the medical staff in diagnosing and assessing their lesions that they're presenting with. So I've already tested this on several patients.